10, 15 years out, EMRs are just no longer going to exist. My favorite chart that I saw recently, and it shows that doctors increased pretty linear, but healthcare admins went like this, vertical. I don't think that you can solve the healthcare admin and bloat and cost problem without something drastic. If you talk to a doctor who was using Epic on day one versus a doctor who's using it today, the system looks the same, it feels the same. It's not actually removing work for the doctor, but Agentic AI does the work for you. Why would we be investing resources in automating things inside of existing EMRs with Agentic AI when you can build entirely new systems with Agentic AI from the ground up? The AI agents basically takes information, inputs, context from all sorts of different sources and takes actions.
Welcome to the second episode of Momentum Reimagined. My name is Amit Bhanti and I'm your host, and it's the podcast where we explore the stories and sparks that move industries forward. Today's episode is going to ruffle a few feathers because we're talking about Agentic AI. Joining me is the man who's been living, breathing, and probably dreaming algorithms. My son and CEO of Hike Medical, and one of the boldest minds that I've ever known, Aadi Bhanti.
Hey, nice to be here. Excited to be on the second episode.
Yeah, I've been super excited about this, right? I mean, doing an episode of a podcast with my son. I think it's pretty cool.
Yeah, it's a great opportunity. And I think not a lot of people know how closely we work together and all the impact we're making. So I'm excited to spotlight a lot of that today. I don't know about the boldest mind, but we'll see. We'll see if people agree.
Hey, you have been one of those guys. I still remember, I think when you were 10 years old, we were going through a Starbucks drive-thru, remember? Or maybe you don't remember, but...
We went through many drive-thrus. Which time are you talking about?
Remember when we were going through that Starbucks long time ago, and I must have been telling some cool story about how we've helped, how we help different people who can walk and things like that. When you looked at me and said, Papa, you think you're all that and you're so great, and you have this clinic and you have this company and you're doing really well. Trust me, just like we got that coffee out of the Starbucks window, there will be a day when people will just come to a drive-through and they'll just put their leg out and get a leg out of it, right? And I was scratching my head. Knowing you at that time, I've always known that you're a very differently thinking person. But that day I was like, maybe he's right. Maybe things will change. And I won't say that drive-thrus are quite a reality or will ever be in healthcare, though drive-through pharmacies are a reality. But things that we are doing are really, really getting close to that. A lot of things are changing.
Yeah, totally. I think, the drive-through might have been a little bit of a pipe dream, but I think directionally it's accurate in the sense that a lot is changing. We're obviously leading part of that change, but it's happening across the whole industry where healthcare is no longer, it is actually an extremely complicated system with various stakeholders, a lot of people who maybe shouldn't be in the ecosystem in any capacity just due to old systems and tools they're required to exist. I think my favorite chart that I saw recently that, not necessarily relating to the Starbucks example, but it kind of does. There's a chart kind of showing the growth over the last 20 years of healthcare staffing. And it shows that doctors increased, like this, pretty linear, not too exponential from a growth perspective, from a staffing point of view. But healthcare admins went like this, vertical, right? Maybe 5 or 6 times the pace of doctor and medical professional hiring, actual clinical professionals. And I think that's the core of the problem, right? You have way too many administrative people in healthcare. And now we're finally in a time where the technology is going to allow for a lot of that to change, which ultimately saves money and provides a way better experience for patients. And that's who we really do it for, right?
I think I agree with you. And I think that lends itself to another discussion, that we had, right? You've been saying for a while now that EMRs are broken and that AI, specifically Agentic AI, will replace them. That's quite a big statement. And do you think it's the EMRs that are broken is why that rise in the numbers of admin? I mean, how many people it takes to support one clinician?
I think that's part of it, right? If you look at an EMR, first of all, a lot of these tools were built 20 plus years ago and really haven't changed that much. If you talk to a doctor who was using Epic on day one versus a doctor who's using it today, they may tell you there's some new modules, there's a patient-facing tool called MyChart, and there's probably a bunch of little upgrades and reliability details that have changed. But at the end of the day, the system looks the same. It feels the same. It's not actually removing work for the doctor. And it's usually one of the most dreaded parts of any provider's day is actually interacting with their EMR, whether that's in O&P with platforms like OP, which, are extremely archaic, or whether that's in, traditional medicine with platforms like Epic and Cerner, which are also, equally archaic, but maybe have a little bit more R&D. It's pain across the whole industry. And so going back to the agentic AI piece, there's a lot of companies out there who are building agentic AI to automate stuff inside of the EMR for people who are using existing EMRs. And I think to most people with a short-term view, and short-term meaning 5 or 10 years, that's the right approach, right? Switching costs from an EMR are extremely high. For a large health system to switch from an EMR to a different provider costs millions and millions, maybe tens of millions of dollars. But if you're thinking about it from a long-term view, why would we be investing resources in automating things inside of existing EMRs with agentic AI when you can build entirely new systems with agentic AI from the ground up without an EMR in the first place? And I think that's really where everything's going. So picking verticals where you can do that, enable it, and then expand horizontally is going to be really important.
I think EMRs were really built for billing, right? Not necessarily for healing or providing care. And I think as we look at agentic AI, it's built for reasoning and ultimately having the ability to provide better care. When you're talking about this and what it takes for people who are on the current EMR systems and what keeps them from moving on to things more modern and the amount of money that it's going to take, I think of, when Lee Kuan Yew made that big change in Singapore, when Singapore was trying to build a new airport and they were looking at a certain area and they'd spent hundreds of millions of dollars there, but he was super involved in that because he wanted the airport to be a true economic engine for Singapore. And he completely scrapped that project, even though hundreds of millions of dollars were already spent, and kind of mandated a completely different area where Changi is based right now, right? And we all know Changi consistently ranks in the top 1 or 2 airports in the world. It's become quite a significant economic engine for Singapore. People like connecting there just because of the a forward thinker that he was, and I think that's kind of how people need to think. If you really want to take a leap, you need to take a leap rather than taking small steps. Make that leap, but I think sometimes you just have to bypass everything and make that bold decision.
Yeah, I mean, I think you know me well enough to know that I don't really believe in incremental change, especially for important problems. I don't think that you can solve the healthcare admin and bloat and cost problem without something drastic, radical, some may say. And, we're seeing a lot of that, right? The courageous leaders in healthcare, they're the ones who are winning at the biggest scale. You see lots of examples like this. And on the flip side of that, you see companies that refuse to make a change. They show up to the party late. There's still companies that are switching. There's still healthcare providers that are switching from paper-based records keeping to EMRs. Like that's actively happening right now. And I think a lot of us in this tech world kind of lose sight of that. A lot of people don't really understand that, agentic AI is here, sure, but a lot of people are still adapting to the previous wave. And so, I'm curious actually, maybe to flip the script a little bit and ask you a question.
Yeah.
Do you think that people who are still using paper-based record keeping, do you think that this is an opportunity for them to leap and skip the EMR step and go straight to agentic systems that, do something as simple as take in a fax and handle every action, handle all the scheduling, queuing, compliance, and management, and they get to just be the provider? Do you think these people will skip the EMR, or do you think, are you in the camp that believes in EMRs, the foundation to, successful deployment of AI in a healthcare?
Yeah. No, I totally agree with you. At the end of the day, it's going to be their decision. But I think people who are still on paper charts and things of that nature. I'm not sure, Adi, if you have any data on how many or what percentage still is, but if they're there, I mean, this is probably the perfect opportunity for them because the deployment costs are lower. They can really make a massive leap, right? I mean, they can actually deploy agentic AI or much more modern systems, if you will. If they want to go into digital transformation, some people are still thinking, hey, I'm going to add that second fax, right? And that's not what's going to make you leap forward. I really think they need to be thinking differently. So I think that's the case. I would, again, remember for others that don't know, I came from India, right? And in India, cell phone revolution came a lot later, right? In the US and some of the other Western economies, CDMA-based systems were there. When the cell phones came into India, they came on GSM. What that did was it really made the adoption of cell phones and things related to that really fueled the economic engine much faster. And the deployment was really, really fast. And I think that could correlate to the story, Adi, to a certain extent, I would say. So yeah, I think the time is right. And people who are still on paper chart should be thinking of.
Yeah.
So Adi, I have a question here. So I think we should talk a little bit more about what agentic AI is, just so that people who are not super familiar with that, get to know it a little bit better.
I think it's a term that a lot of people get confused. It's a buzzword right now. Everyone is throwing it around and using it, whether that's to attract investment or customers or interest. And I think a lot of people maybe have a misunderstanding of what this actually is. But just like human agency, right? The ability to take actions, put yourself in situations that you want to be in. AI agents are kind of similar. They take actions on behalf of a particular entity or individual. So a good way to think about this right now, most people who use AI are probably thinking about something like ChatGPT, which is kind of like a much smarter version of the chatbots that maybe we're used to. So you go in, you can ask it questions, it'll review documents, it'll predict the next best word. That's kind of that's more at a technical level, how the transformer and how the LLM works. But agentic AI basically takes information, inputs, context from all sorts of different sources and takes actions. So what we're building, for example, on the Hike side is, a prescription will come into our system. Our agent, in this component will actually review that document, right? We'll extract information. We'll compare it against our rules engine. Based on that, our tools will take, a series of 10 or 15 follow-up actions to get that patient ready to schedule. And then an AI agent, an agentic phone call will go to the patient and it'll ask the patient questions. It'll have a full conversation. It'll record that back in our system and then it'll take the next action. And so AI agents are just, it's another term for basically tools that kind of do the work autonomously for you versus, kind of a co-pilot type system where, you're chatting with it, you're asking it questions, it's helping you with your work. The AI agent actually does the work for you. I guess is at a high level the best way to describe it.
No, that's great. So yeah, most people think it's just like you said, it's like predictive, right? I mean, most people think agentic AI is predictive, but really it actually acts on your behalf. So Adi, with what you said, I really think that's already a productivity revolution.
Yeah, I mean, it depends on, I think it all comes down, there's a lot of really cool technology, but it all comes down to how well it's deployed and implemented. That's going to be, that's going to make all the difference. I think, especially at the enterprise level. I saw a study recently and I'm not sure, for the record, I'm not sure how accurate this study is, but it said that, less than 10% of enterprise AI, agentic AI deployments were successful. And I think my gut tells me that there's a lot of foundational work that needs to happen at organizations before they deploy AI. Things like getting your data much more structured, actually understanding step by step what the workflows are. It's kind of like a human being, right? If you're going to hire a new employee for a specific function who's going to take on, a whole set of tasks, you have to have the right training materials. All the data has to be accessible for them. You have to
Onboarding.
I mean, it's almost the exact same thing. A lot of times, people may think that agentic AI is a solution to all your structural and organizational problems, but really you have to solve those problems first, and then you can deploy the AI on top and, kind of generate exponentially better results than maybe if you didn't do that upfront work. So kind of like what at CPO you all did with structuring your data, setting up, a proper cloud ecosystem where like a nice data warehouse where all your data feeds in from all the different sources, having a team build, proper querying mechanisms and proper analytics. I think those are all things that people need to do to see success. Obviously, there's smaller deployments and easier things that, you can do, like things like eligibility verification using AI agents. I mean, that's extremely easy to do. Most healthcare organizations should be able to do that. But to do things that are more complicated and things that actually deliver real value, those are kind of like the things that we're doing at Hike and CPO. That takes a lot of upfront work. But I think part of that upfront work is actually just using the right tools that give you the structured data in the first place. So tools like Insol's AI, Simpler, et cetera, that are modern, have APIs, have clear data structures. I think starting to use tools like that are a great first step to actually getting your organization ready for agentic AI.
I think you stole some of my thoughts there, Adi. I was presenting at California Orthotic Prosthetic Association meeting last week, and that's one of the things I said there was get ready for it, right? You have to really set yourself up properly before you bring in a new agentic AI system and you want to deploy that. Make sure that you have all your processes in place because context and context can be built through LLMs and things like that, right? I mean, that can learn, right? But the processes have to be right because if you throw AI or agentic AI on a bad process, it's not going to work. And each process may have like hundreds of sub processes and nuances and thoughts. And unless you have thought through all of that, no matter what you put on that, is going to be bad, right? I mean, we always say, in orthotics and prosthetics, we always say measure twice, cut once. And I think that's pretty much what you're saying, that let's make sure that your processes are right, you're using the right tools in your organization, so that if and when you decide to deploy something like this, which is really going to make a big change in your productivity, you'll be ready for it.
Yeah, no, and I think just kind of going off that point, a lot of people, believe that, and I'm curious for your take on this because I think I'm one of these people. I believe that eventually the AI tools and like the foundation models that are powering a lot of this agentic work, I think eventually these tools will get good enough to the point where you actually maybe don't need the training materials, you don't need much of the context. I think you can jump in and do a lot of the work. I mean, if you compare GPT-3 to, GPT-5, for example, our engineers say that, a huge amount of their code is actually written by AI, right? And they're just jumping in and reviewing it. But maybe, 6 months or a year ago, that wasn't possible. I think the same thing will happen here, right? Where these tools will just understand what needs to happen in this particular healthcare workflow. It understands the rules. It knows what it needs to do. It can jump in and get an understanding of the systems and the schemas and act, on your behalf. Right now, there's a lot of upfront work, right? A lot of the AI agents that you see out there in the market are really just, the AI component of it is significant, but the real magic is in how the agents call tools, how the agents interact with your systems, what do the integrations look like? And I think eventually you won't even need that, right? But right now you do, and I think that's the most important point to drive across. And it's probably not worth waiting because the productivity gains can be extremely significant. So everyone who's using this stuff now is not just getting the benefits today, but they're making a long-term bet that it's going to actually be significantly better over time.
I think it's going to, become much more powerful, right? So again, going back to the framework of agentic AI, when you think about context, process, and trust, I think you're talking more about the trust part of it, that there's a lot of, initially there's human intervention that feeds into that builds trust builds adoption. And then adoption continues to build trust where the human intervention keeps going down, where at some point, a patient walks into one of my clinics, right? And they probably already have a pre-scanned foot, right? Based on which a summary has already been created, because we had all the doctor's notes, all the other documentation that was required, eligibility verification already completed, maybe has already written a whole, evaluation and treatment plan for the patient. And practitioner has to see the patient, ensure that, the practitioner does their healing part, if you will, right? I mean, spends that good time with the patient, engages with the patient rather than typing notes majority of the time that they do currently. And, the whole process becomes much faster. And I think that's super meaningful. That's probably going to change how we practice healthcare.
Yeah. And I mean, God knows we need to change how we practice healthcare because it's become patient last, right? It's become payer first with things like prior authorization. I think we talk a lot about how providers are burnt out, which is an extremely valid point. Providers need, I mean, it's a pretty rough world out there. They're spending huge amounts of time doing notes and documentation, which is all important. But if we can take all that work away and doctors and clinicians can do what they originally signed up for, which is taking care of patients, providing them with a great experience and ultimately solving their problem, I think we're going to end up in a much better world. But it has to be patient first. Even agentic AI that drives efficiencies inside of your business and optimizes documents and does all of these different things, you have to think about it from a patient first lens. So why are we automating eligibility checks, right? Why are we automating intake? Is it to eliminate one person in the administrative team, or is it to make sure that patients who are on the verge of losing a toe or losing a limb can get in, get seen, and get their inserts quickly? And as long as we're framing it in the latter and not the former, I think we'll end up in a very good situation. And that goes back to the conversation around, is AI going to replace jobs? Is it going to, do X, Y, and Z? I think the answer to that is yes. AI will replace some jobs, but that's like every technological revolution in history, right? I'm sure a lot of people, I'm a little too young for this, but when computers were coming out, I'm sure a lot of people were thinking, I'm going to lose my job. Or when the internet became easily accessible through computers, I'm sure a lot of people thought, I'm going to lose my job. But ultimately, new jobs are created. There's new needs for expertise. And in healthcare particularly, I think there's plenty of problems that these people can focus on. But right now, everyone's just lost in the sauce of making phone calls and sending faxes and reading 15-page prescription and note documents. And if we can eliminate all of that, your entire staff can actually be focused on generating better ROI for patients.
Yeah, I think, so taking them from click work to care
Yeah,
is kind of what our job is.
absolutely.
I think, what's wild? We look at practitioner utilization within CPO pretty closely. And, that data, when we look at that, it's pretty wild because every time we look at the utilization, obviously there's some super productive people. But if you look at a normal practitioner in an 8-hour time frame, we see that 50 to 60% productivity, right? Because it only looks at the times when the patient was scheduled. It does not account for all the time that the practitioners are spending in the clinic or outside of clinic, finishing all the documentation and paperwork and everything else that they need to do, like calling in orders and, chasing stuff that really delays patient care.
Yeah, no, 100%. Totally aligned there. You talk to lots of clinicians every day. What are they saying? What are they saying about AI? What are their fears? What are their questions? What are the things that they're excited about? I'm curious. Obviously I talk to lots of clinicians too, but would love to hear kind of the perspective that you're hearing from, your own team on a regular basis.
I think most people, on the CPO side, you saw how adoption of insoles.ai slash hike system went, right? I mean, initially, obviously, there's always going to be some naysayers. There were some people who are worried. Change is not easy for a lot of people, right? So change management becomes super key. Fear of the unknown. All of these factors sometimes slow things down. But I think you really, really, most people understand that this is coming, right? AI is going to be a part of it and they need to adopt it. And I think it really, I think it's the leadership in any system that needs to drive this change and really show people the light at the end of the tunnel. I think we've seen that at CPO and many other organizations that we're working at. But, I just like you said, I speak to a lot of people. There was a gentleman, I think when I was speaking at the New Jersey meeting a couple of weeks ago in the question and answer session, he said, hey, with the way you guys are scanning, when things are, it seems like it's very transparent. You're picking up a lot of data. That means it can land me in trouble because if I miss something and that led to some problem, it can get me in trouble. I can get sued. And I was like, that was quite an interesting take. But
Yeah.
I really think to flip it the other way, there are things that we miss, right? When we're looking at a patient, we have so many patients scheduled. We have to do so many things. We are thinking about so many different things, but we do miss things, right? And I think because it's more transparent, when AI is picking up a lot more than what your eyes are picking up when you're scanning a patient, and if it notifies you that, hey, by the way, you might have missed a toe,
Yeah.
or there's a callus there that you might have missed, because documenting all that, I think you have lesser chance of missing something. So yes, I think instead of landing you in trouble, I think it keeps you from getting in trouble.
Yeah, I totally agree. And, not to ruffle any feathers, as you said at the beginning of this recording, I think to the gentleman who asked that question, that is a prime example of patient last healthcare, and that mindset that needs to change across providers in the country. But you can't blame him, right? The
Yeah.
system is built in a way that wants to penalize providers, especially for something like O&P, where there's just a ridiculous amount of compliance restrictions, lots of checks. And while there's nothing wrong with that, we've got to make it more efficient for people to actually deal with these systems so that this nice provider in New Jersey doesn't have to think, oh, am I going to be penalized for using the latest and greatest technology? They should be thinking this is going to help me take care of my patients better and never have a doubt about it. So I think it's like a systemic problem that eventually, the PTSD will go away from these providers. But, to me, that's ridiculous take in the first place. But then when I zoom out so as a technology person, that sounds ridiculous, being honest, right?
Yep.
If my clinician or doctor said something like that, I would be absolutely shocked. But then you zoom out for a second, you put yourself in the shoes of the provider who's been penalized and squeezed and pushed by payers and everybody else in the ecosystem for so long. You just want to arm them with the tools to make them more efficient so that they don't have to have thoughts like that and can actually focus on the patient. So that's an interesting perspective and also interesting to view it from both sides.
Yeah, I think you have to view it from both sides, right? Because, at the end of the day, like you said, patient first or provider first, patient first, provider second, or whatever. I think at this point in time, and compliance is very important, but compliance has to be managed differently. I think if you're constantly, if your exceptions become rules or compliance is, and if you're just constantly thinking about that, which we need to, if you're constantly thinking about that, then there's no time for patient care. So what we really need to work with systems that actually do it for you and drive the right behavior, if you will, right?
Yeah. Yeah. I think compliance should just be on autopilot. I think eventually, with the way things are going, I almost imagine a world in which it's impossible to not be compliant, right? Because all the tools themselves just make it impossible to not be compliant. Whether that's, checking the types of codes you're using as you're doing your billing, whether that's making sure that you capture and document every ulcer and callus on a patient's foot as you're scanning them, whether it's making sure that a patient actually qualifies for a service you're going to provide them ahead of time. I think all of these things can actually be done on autopilot. And the only compliance you need to worry about as a clinician is, am I giving this person the best possible care to solve their problem within, a reasonable set of constraints? So that's I think that's where this is all going. And that's a really great way to sum up.
So, just to close out this piece, right? Like I said, from clickware to care, I remember one of our prosthetists saying, if I could just talk and the system understood what I meant, I'd see 5 more patients a day.
Yeah. Do you believe that to be true?
I think close to it, right? I mean, if the systems or if AI could be that true co-pilot,
Yeah.
then all we'd be responsible for is to land that plane safely.
So how do you feel about like ambient listening systems and solutions? Have you looked at any of them?
Very close. I mean, ambient listening systems that are being part of some EMRs. I mean, it does the notes, right? Which is great, but that's not in my opinion, right? It can get you there, but there's a lot more work. But is that ordering the product? Is that scheduling the patient? Should all the automations need to be built in from an ambient system for it to become so yes, it's a great start, but it's not what's needed.
Yeah. So how do you feel about companies like, I'm struggling to think of some examples, but I think one example is Tenor. They're really building these systems, but they're building it on top of EMRs, essentially. How do you think about those? Do you think that those features should be built in to the next medical record system? Do you think it should be an entirely new system built from the ground up? Or do you think it just looks completely different in the future, where maybe all a healthcare system has or a healthcare provider has is a simple dashboard with all their patients if they want to call them or something, but really it's showing you what all your AI coworkers are doing in real time. I mean, what do you think the interface looks like in the future that you're interacting with as owner of a clinic, as a clinician in a clinic group, as an admin in a clinic group? What do you think the experience will be? Like, describe a workday in the future.
So anything that, all these companies that you talk about that are building these systems on top of EMR are really stopgaps in my opinion, right? I mean, basically I think they're doing a good job. It's needed, right? Because it's going to, maybe help you with that gap that exists right now. So it's important. I think it's also going to provide a lot of learning for those fully connected systems out there that develop for the future. But I don't think that's the future. I think the future is where you walk into your clinic, just by virtue of you walking into your clinic, you have all the updates. I mean, your AI co-pilot has already created summary for most of your patients. You have past data, outcomes data, everything already provided to you. It also tells you that, hey, these patients already have authorizations, approvals, to what extent you should proceed today, right? And based on the past data from your own clinic or from all the other data that exists out there, you should actually know that a patient that's been sent to you for, say, for example, low back pain, just saying, right? I mean, so a low back pain patient that you're supposed to see today was white, male, 36 years old, has a diagnosis of spondylolisthesis, all of these different things. That data, because you already have it, your system already has it, it's ingested it from different intake systems, actually should have already created much of that, right? You should know all the codes that are going to be used, 5 possible products. And again, I'm just talking about orthotics and prosthetics. And you come in, you verify, you see the patient, you talk about, give them reassurance, maybe come in and change a few things based on your experience. But majority of the stuff should already be, those meaningful insights should be on your palm, on your phone or iPad or whatever you use, rather than still having to do all of these different things that you're having to do now. So it's going to look very differently.
And what's it going to look like downstream, right? So now we've talked about the clinician experience. We've talked about what is agentic AI. We've talked about, some examples of it and how that looks inside of this healthcare office. But what do you think the downstream impacts of that are, right? Like maybe not directly related to the AI, but in terms of other things, like what professional training and skills do you think clinicians will have to focus on to be successful in the next generation with agentic AI? What things will they maybe have to spend less time learning as they're coming into your practice? When you're looking at a new generation of residents or a new generation of young clinicians, what do you tell them about the future? What you just described is a world where they have to make a lot less decisions. Most of their decisions are related to the direct care of the patient and looking at pre-baked options, probably a lot of what your day looks like, where your team comes to you with a bunch of pre-baked options that have been explored, and then you pick. But how do you think that'll work when really like every clinician is the CEO of all of their own cases and they have a full team of AI coworkers?
Yeah, I mean, that's going to change life. I mean, currently when a clinician comes in, right? Say, for example, you're a resident, you're just starting out your life, right? You're just out of school. Schools don't teach you enough about business. Schools don't teach you enough about codes and things like that. Even if they do teach you, there's so much that comes with experience. Coding is a big problem because that drives the whole compliance part, that drives the whole reimbursement part, and at the end of the day, profitability of a private practice. So that has to be done right.
So if
there's
I had to push back on that, though, just real quick, because you're talking about coding, but if the AI is doing all the coding and the administrative work at a high confidence, is it even worth it to start teaching clinicians how to
No. So that's what I was saying. So currently, I'm talking about the current state, right? So when we bring in a new resident, there's a lot of focus on, hey, this is the code that's used for this kind of procedure, this diagnosis, and this patient population, right? Or, hey, in prosthetics, you code like this because we anticipate that this patient's going to be a K3 ambulator and things of that. And it's very nuanced, right? And it takes a long time. And one mistake can lead to catastrophic problems for a practice, right? We see denials on a daily basis and the collection rates go down. If you're provided with 2 or 3 options based on all the past outcomes, not just clinical outcomes, but reimbursement related and business outcomes, if you can give that information, yes, we don't necessarily have to teach, clinicians that part because it's being, served to you in a way, right? So it's going to change quite a bit. Adi, I think one of the questions in my mind that I always think, do you think EMRs failed us to a certain extent or failing us at this point in time?
No, I don't think so. I think maybe failing is a strong word. Obviously, the broad adoption of EMR was driven by government paying credits to provider groups to obviously leverage EMRs. And I don't know if you're familiar with the term, I'm sure you are, regulatory capture, how obviously like that drives a huge impact on what tools and things people are using. But obviously the CEO of Epic, who's a legend in her own right, really built one of the coolest, most long-lasting, enduring businesses of all time. She had a great relationship with the president at the time, right? And eventually she was able to join the healthcare IT advisory board in the White House and get this credit created, which led to the adoption of Epic. So now you have this product where it's impossible to switch. Honestly, for the largest health systems, tens and hundreds of millions of dollars, people were paid, as some people say, out the wazoo to actually use this technology. And it made a huge impact at the time. There's no doubt that healthcare data is much more connected. The experience is much better. But for providers, the experience hasn't improved. So we made this big change and it was awesome at the time. But now, 10, 15, 20 years later, it hasn't changed at all. So, just like one incremental change, but then all the other incremental changes that were supposed to happen didn't happen. So still an overall win, because without EMRs, we'd probably be in an even worse data situation, even worse interoperability situation. But I think if people are still using EMRs in their current form today, 10 years from now, then I would consider it a catastrophic failure. But I think right now, that's really the best you could do until very recently.
But I really think EMRs make things very transactional, right? They were designed for reimbursement audits, not for real-time reasoning. And I think that's where, if you think about it, right, mostly for reimbursement and compliance-related stuff, not for patient care. And that's what bothers me all the time.
But I think, that's a broader healthcare problem too, right? It's not just EMRs. I think way too many things in healthcare are designed for not patient care. But I think if we go back to the foundational goal of healthcare providers, it is to provide care, to heal your patients, help them through their darkest moments. And sometimes the tools and technology don't always translate to that. And sure, people have to get paid, people have to make money, they have to run profitable, healthy businesses. And maybe the way they do that will change over time. And I think EMRs maybe lend themselves to that. I'm hoping, to your point, a lot of these new AI agent tools and systems are more patient focused, which I think will just lead to better outcomes for the businesses. Because you're right, made for billing.
I mean, I've looked at many EMRs, they all have the same problem, Adi. It's like data in and no intelligence out.
And I think we know that there's some that are worse than others, but sure, that's definitely a common problem.
But I think agentic AI can really help us, connect all the different points or bubbles, if you will, and build on that ecosystem. Instead of silos, you get the network of systems that think together. And I think that's what's going to change. So you don't have to be in the silo of your EMR and that's all you do. And in order to do anything different, to think outside the box, you have to jump over mountains. And a lot of EMR companies make it very difficult for those mountains.
I think that's totally intentional, right? That's the business model. And I think the way tech companies are moving now, especially with agentic AI, is you're going to get paid for the value you create rather than the way EMRs charge today. And that'll be a whole new world, right? Like, why shouldn't we get paid for the value, the ROI, the revenue that we help drive, or the savings that we help create for a business rather than, hey, here's our kind of arbitrary fees. This is what we charge. You want to change the look of a button? Here's a $10,000 invoice. I think that model of software is out, and value-based, just like value-based care is a pretty common term nowadays and buzzword to a certain extent. I think value-based software pricing models are going to be really important to realizing that future so that vendors like Epic or OP don't get complacent. like they are today.
So, Adi, let's talk about our own sandbox, right? Hike, CPO, Simpler, if you think about it, right? Simpler at CPO and Hikes, and, it's on Hikes AI backbone. How do they intersect?
Yeah. So for those of you who don't know, there's a platform called Insoles AI, which was originally made just to service shoes and inserts patients. That's being used obviously across CPO, but hundreds of other clinics as well. And this makes it extremely easy for clinicians to scan their patient's feet, do documentation. We automatically generate a Medicare compliant note, put it into their EMR, et cetera. Simpler was the extension of that, built on top of the Hike AI engine for all other aspects of billing, coding, purchasing, procurement of these devices. And they all kind of intersect together because ultimately every form of care in O&P specifically is actually the same, right? You've got a patient, typically they come in from a referral. There's some sort of compliance rules in between that patient and you seeing them. Once you see that patient, you've got to order some sort of device. You've got to keep track of what you actually talked about when you visit that patient. And then you've got to actually make sure that they get the device and make sure it works. And then you have to get paid. That's the general workflow, not just O&P, but really DME as a whole. And so all of this stuff intersects. And if you can use all of that historical data, which we had from CPO, which provides you a really strong foundation in understand each little niche step that can happen, all these systems start to work together, like you see with Insoles AI and Simpler, connecting, pulling from one patient roster for as a simple example, but a more complicated example being leveraging kind of the same scanning engine across the whole board for various body parts. So yeah, I think that's kind of how the systems are connected. But is there something else you wanted me to touch on there?
No, I was just thinking, right? Simpler provides the structure, a digital network for independent clinics, right? Adds cognition. Think of Simpler as a circulatory system and Hike as a brain, right? I mean,
yeah, I get what you were getting at there.
Yeah,
And that makes
yeah.
a lot more sense, right? Simpler is one of many tools that feeds context into the AI engine. So it's giving us information about the patient, about what the clinician saw, about what they want. And then Hike can come in, take part, and actually help make those decisions. So actually, that's a really good way to think about it.
Yeah, I mean, I've seen it firsthand. Authorizations done before a practitioner even asked, right? I mean, that's kind of where we've been going with CPO anyway, right? Because it's all in the past, it was all driven from the paperwork that came in, and our central team did most of that. But now, at least on the foot orthotic side, right, it's all being driven through the new brain that we have received through Hike. So I think it's pretty cool, right? Those clinical notes and drafts, patient communication, that's happening as we speak. In the phone calls that you were talking about went online yesterday. So it's pretty cool what's going on, right? So we're not talking about adding another software. We're talking about removing friction, really, right? So we're not adding more software. So let's address the headline, Adi, right? Are EMRs going to die eventually?
I think so.
I mean, I think this is a question that you asked me early on. I'm just flipping it back to you because you.
Yeah, no, I think this is a great way to wrap up the discussion because we actually started by talking about one of the first things I said is if you have a short-term view, you're building tools that are making EMR slightly more efficient. You're maybe using some sort of browser agents or tools like that to click around in the browser for a particular client on a virtual server and move processes through automatically. And that's your version of agentic AI. That's what most of these healthcare back office automation companies are doing today, which is just another version of outsourcing your RCM work to a different country, right? Or offshoring that work. It's kind of the same concept, but the real future is all of this stuff happening automatically with AI coworkers. There's no need for a UI. Like the UI is simply an analytics page and a details page showing you what's going on, but there's no actions that you can take because you don't need to take any actions other than jumping in and resolving conflicts and things like that. So yeah, I think 10, 15 years out, maybe a little bit more, EMRs are just no longer going to exist. The people who are going to really win are going to figure that out much sooner. And then
Hey, somewhere an EMR vendor just threw their laptop.
No,
I'm just kidding.
Hey, they've got plenty of dough, so hopefully they can buy another laptop, right? When you're extracting value from the system for
Long time.
5+ years, you should
I
be.
think we're giving them a future. The data models can feed agentic systems that actually use the data, and maybe they can be forward thinking and adopt some of this. It's almost like a lifeline. Otherwise, things are going to go somewhere else.
Yeah, I mean, I think a lot of them are, right? But a lot of these organizations move extremely slowly, and they, there's a reason why we're kind of coming up to the time period for this, every 25 years or so, you'll see a huge shift in the way things are done, specifically in healthcare. I think we're getting to that point. So we may actually see some new winners. Whenever I have kids, they may not know MyChart and Epic. They may just be getting texts from an agentic representative of the doctor or talking to this person, getting real-time insights about their personalized healthcare. rather than, hey, here's a MyChart link that you can log into after 50 steps and maybe view a report if your doctor chose to upload it.
I like the sound of when you have kids, right? This is a great story. I think it was like 10, 12 years ago when you came up running. I was in clinic, you were working, or you must have just been visiting our office. You came up running and said, Papa, I saw this amazing thing. I'm like, what is that? And he said, Donna auntie has this printer where she types on it and it prints right there. And, you don't even have to go print it and go pick up from a printer. It prints right there. And I started laughing because she was using a typewriter, which is something I'd never seen. I think something like that may happen, when your son or daughter might come running upstairs and say, hey,
MyChart is definitely not as cool as a typewriter. I still believe that typewriter is the way to go.
So, there's always pushback, Aadi. I think this is something that I want to address on this discussion, right? There's always pushback, right? Healthcare isn't easy. AI is too risky. What about privacy and things of that nature, right? What do you think? Should be the answer.
Yeah. I think, first of all, security and data privacy, all these things are extremely critical, but also these are solved problems, right? I think it's going to continue to get more complicated with AI tools and, from a cybersecurity perspective, AI versus AI, cyber wars. There's some news that came out recently about getting attacked using AI agents, which Anthropic makes one of the, they're one of the foundation model companies. With all of that being said, I think if those are the things you're focused on now, rather than how can you create as much value for your patients and for your business as possible, that's a never-ending trap and cycle, right? I think the number one thing is start with simple use cases, get experience, optimize your organization to actually succeed with these tools, and just get the party started. Don't do it in a reckless way. But to people who are focused on those types of things, healthcare isn't easy, et cetera, I would say the same thing, right? But the reality is that just doesn't matter because it has to happen. It's bound to happen. The question is when. And I think some people, that answer is now. Some people, the answer is, when I'm long gone, 60 years from now, I happen to be in the first bucket and will be doing everything I can to make sure that first bucket is correct.
Yes, true. And clinician burnout, something that gets questioned a lot, right? It comes up all the time. I think clinicians burn out not because of patients, but because of paperwork. And I think agentic AI is really going to help with that. And I think it's going to really help the whole process for the practitioners and patients. We joke internally at CPO that AI doesn't take jobs, it just takes tasks. And I think that's going to be the big differentiator. So Aadi, we've covered a lot today, right? From the end of EMRs to the rise of living ecosystems. If there's one message you'd leave for healthcare leaders, what would that be?
I think believe. That one word, right? Just believe. Yeah, I use the word conviction a lot day to day, but I think this is even deeper than that. You have to believe to develop conviction. And I know that may sound like a little bit of a chicken and egg, but you need to at least believe in the future in order to develop conviction around a particular idea or solution that will get you there. And so, yeah, all I'll say is believe, be optimistic. I think look at, the last 50 years of time and all the things that have happened and progressed. It's hard not to believe, right? If you're an optimistic person. And if you look at the world with the lens of abundance, then you should be able to very quickly believe in the possibilities and then work to develop conviction on solutions by getting smart, right? I think if your only source of news on AI is like the New York Times or a Wall Street Journal article, you're behind, right? You really need to look at the right resources. What are the most cutting edge people in healthcare doing and following those trends rather than people who are speaking to comfort the particular opinions that you may come from, which is maybe more pessimistic on this topic. So yeah, I'll leave it at that.
Healthcare innovations isn't about chasing technology. It's about restoring momentum to human connection, right? So I think that was great, Aadi. It's always great chatting with you.
We'll come back and maybe talk about how the AI deployments went next year or a little bit later.
Awesome. Hey, thank you everyone for listening. Visit momentumreimagined.com to explore more episodes and to see how agentic AI, Simpler, Hike Medical, and Insoles.ai are redefining healthcare. Thank you.